Welcome to the Diffuse Podcast with host Philip Grindell, CEO and founder of Diffuse, a global threat and intelligence consultancy that blends psychology and intelligence to mitigate threats and risks to prominent people and brands.
Hello, everyone, and welcome back to the Diffuse Podcast. Now, I know I say this probably every time I do a podcast, but this one's going to be really, really important and interesting. I think what I find every day is I open the newspapers and there's someone talking about somebody being a narcissist or a psychopath or a sociopath and all these other various things. And I wonder whether we actually understand what those terms really mean. And I would probably gamble that a lot of the journalists don't really understand what those terms really mean. And that's why today's guest, Dr. Caroline Logan, is going to be so interesting. I met Caroline a few weeks ago in Paris, and bizarrely, we ended up going for a drink, and with a whole grand gang of us, and I was probably the only non-psychologist there. And we had the most fascinating conversation, which is what motivated me to do this podcast around, well, what do these things actually mean? And how do we know if someone's this or that or what have you? And does it matter if they're this, that or whatever? So Caroline has got, I'm not going to read her bio out because it's so long. I'd probably spend the whole, not because it's full of fluff, because it's full of incredible achievements, but I'd probably spend most of the podcast reading out her qualifications and her resume. Suffice to say that she's one of the most qualified and experienced in her field. And, you know, it was so fascinating sitting in a room full of psychologists and watching how they deferred to Caroline as the expert. And I know she's going to be humbled by that, but that was interesting observation by me to look at what was going on in reading the room, so to speak. So, without further ado, Caroline, welcome. Thank you for volunteering to do this.
Thank you for asking me.
So I guess to start
down after that wonderful.
No. Don't listen. I know you know it's all true. You're just too humble to admit it. But I think where the good place to start is, you know, psychology is a field of such fascination for all of us. Many of us think we're amateur psychologists in terms of, oh, I've been in the police 30 years, so I can read people. And actually, the statistical evidence suggests I can read people no better than the average person. Or when you're going into interviews, you can't tell whether someone's lying or not lying any better than the average person. You might have some instincts, but, you know, whether you're actually any good at it or not is a matter of opinion. But you know, we're all fascinated by psychologists. Over the last 20, 30 years, the kind of field of personal development and personal psychology seems to have exploded. So we all think we've got some understanding of each other and more importantly, ourselves at some point. But I'm not convinced we really all understand some of the deeper meanings of the mind and of how humans behave. And of course, that's your expertise. So how did you become a psychologist, and why did you become a psychologist?
That's such a good question. And there's so much to say in response. I think in brief, however, because I really want to get on to the meat of what we should talk about. I definitely became a psychologist because of my personal background. I came from a family where there was quite a lot of psychological problems in a number of its members, and understanding those problems became integral, I think, to my getting along in life and surviving, really. My father had very severe mental health problems, and I spent quite a lot of time accompanying him to the local psychiatric hospital where he went for care. So from a very young age, I was involved in mental health services as a family member, a young carer. And I think that attunement from an early age meant that I was destined really to do a lot more of it. So for me, there was never any choice about what I would do. I was never going to be an engineer or a lawyer, even the lawyers work very well with people, but I think I was always going to be somebody who spent time talking to people. Well, ideally getting them to talk to me, because I think the biggest gift of any of us is to shut up and listen. And I think that's what I've spent many years training to do, is to talk less, in order to create the opportunity for more information to understand people better. Anyway, so I did an undergraduate degree in psychology. That was in Glasgow. And then I worked in a very kind of low-grade post as an assistant psychologist. It's not a low-grade post. In the grand scheme of psychology work, it's you've got a graduate degree, but you're not yet qualified to practice. So it's a kind of lowish post, but it's an invaluable post to get the credentials, to get the experience, to enable you to then do a postgraduate qualification that specialises you in the practice of psychology. So for me, that was my second degree was in clinical psychology, also at Glasgow University. I then diversified because I'm really interested in research. If I want to understand something, I like to go to the nth degree to try to do so. So I often did a doctorate, a research doctorate, and then I did a couple of postdoctoral research fellowships, and that took me to Liverpool University, and there I also qualified as a forensic psychologist. Now, great question you asked about how can we determine people's credentials to be able to say that they are the things they say. Unfortunately, for the time being, the word psychologist is not a protected title. So anybody can call themselves a psychologist. And indeed, lots of people will talk about themselves as amateur psychologists, and that's perfectly fine. But to put themselves in a legal setting or a setting where evidence could be entered into a court of law, it matters what people call themselves. So I can't stop somebody from, if I was a manager or a police officer or an employment specialist, whatever, I can't stop somebody from calling themselves a psychologist. But if they are a specialist psychologist, like a clinical psychologist or a forensic psychologist, that will be, they have to be registered with the Health and Care Professions Council as an applied psychologist. So you can look them up. So if somebody calls themselves a forensic psychologist, you can just Google HCPC and UK, because this is only UK relevant, but there will be similar schemes in other countries. You can check whether they are registered with the local organisation, the national organisation that sets the standards for practice. So if you look me up in the HCPC, you'll see I'm registered both as a clinical psychologist and as a forensic psychologist. And that should give you some reassurance that you're speaking to somebody whose peers and academic institutions have said, yes, you've got the knowledge and you can call yourself this thing. That's one part of it. But then the other part of it is the experience. So there's a difference between me and somebody who's just registered as a clinical or forensic psychologist. And that's unfortunately, well, no, it's not unfortunate. It's about 30 years of post, qualification practice. So I have cut my teeth in a variety of different mental health and criminal justice services, and perhaps more for me than for others because of my research background, I have put a lot of what I've done into writing. So you can check my papers that I've published, the articles, the book chapters, and indeed the books. So that gives people a little reassurance. Not everybody does that. Lots of people are pure practitioners and are amazingly experienced as a consequence. I'm just somebody that liked to write things down. So I have more of a public profile than perhaps some of my more deserving colleagues have. So does that
yeah, I guess where the other question then is, okay, so what qualifies you to be a member of the British Psychological Society then? What does that mean?
Oh, right. The British Psychological Society, goodness me, I'm going to be called out here. It's been around for decades, probably I would have said since the 50s. I should know that, but I can't remember. And up until 2005 or 6, I wouldn't have been able to get a job as a psychologist unless I was chartered with the British Psychological Society. The Health and Care Professions Council became the registration organisation at around that time. And it came to be that, for a while, I still do, but for a while, lots of us had chartership with the British Psychological Society and registration with the Health and Care Professions Council. Currently, an employer like the NHS or the Prisons and Probation Service will, in the UK, will only employ you if you have that registration or you're working towards registration. The British Psychological Society has become a special interest group, but not something that's required in order to demonstrate that you have the credentials of a forensic psychologist or a clinical psychologist or an occupational psychologist. The BPS covers lots of different psychological specialities. The Health and Care Professions Council is really about those who work directly with other people in or have the basis for doing that in a caring capacity.
And what's the difference then between a clinical and a forensic psychologist?
Yeah, great. So my training in clinical psychology took me all the way through mental health problems. So I did years of training in what is a mental health problem, the different ways in which mental health problems can impact on a person, how they develop, where they've come from, and most importantly, as a clinician, what we can do about it. So I trained in understanding mental health problems and in their treatment. So a developmental perspective. So that's perspective of the past through to the present and into the future is really important. In forensic psychology, the focus is very similar. They overlap like two circles in the Venn diagram, overlapping circles in the Venn diagram. We have many things in common. Our wish to understand people, where they've come from, how they've come to be where they're at now and where they're heading. But the focus of a forensic psychologist is going to clearly be on matters to do with the courts.
Right.
It's going to be to do with people whose backgrounds and experience take them into contact with other people that results in harm of whatever kind, which means they get arrested, they come before the courts and they're prosecuted. So my forensic psychology colleagues and in the UK, the Prison and Probation Service is the largest employer of forensic psychologists. They are, and also trainees, they are largely involved with understanding criminal behaviour.
Right.
And they've got training in the kind of mental health problems that can be influential, like personality problems, which we'll come on to talk about. Their relevance in people's decision-making leads them to harmful behaviour, but also the kind of mental health problems, substance misuse, psychotic disorders, which in combination, along with early trauma, can result in reckless behaviour that leads to rule breaking and law breaking.
And is there a difference between is there a difference between mental health problems and mental illness?
That's another great question. Now, mental health problems is a term that would be used very broadly. So I can have a phobia about spiders, and that could legitimately be called a mental health problem, especially if that meant that, I had a family member getting married in Australia and I decided I couldn't go because I couldn't run the risk, maybe in the outside of big cities, I couldn't run the risk of encountering one of those, funnel spiders or any other such gruesome, beautiful, amazing piece of nature. So that would be a mental health problem. In the grand scheme of things, it's a fairly minor one and probably a fairly simple one to remedy. And then we could look at something like a psychotic disorder, which is a family of disorders, probably the most common amongst which is paranoid schizophrenia. It's a type of psychotic disorder, and that's a devastating condition. The World Health Organization rated schizophrenia as probably the most disabling, as the most disabling, probably about it, as the most disabling condition in terms of its impact on all parts of a person's life and prospects. So we might use the term mental health problem to cover the full range from paranoid schizophrenia, other sorts of really severe disorders like bipolar disorder, severe depression, some of the neurodevelopmental disorders that can come with really severe complications. So that would be a type of mental health problem, as would our more simple phobias. And there's loads and loads in the middle. And there are a couple of systems that we can, or volumes that we can refer to: the Diagnostic and Statistical Manual, which is published by the American Psychiatric Association and the World Health Organization's International Classification of Diseases. These two volumes, which cover the whole of our practice internationally, list all the different conditions that there are. And that's a volume of mental health problems in the full range. We tend to use the term mental illness for the most severe end. So if I describe somebody as mentally ill, I would generally be saying that they've got a disorder of such severity that that occasionally they lose touch with reality. And that's what we might say about somebody who's psychotic, or they've got paranoid schizophrenia, and then they are in an acute phase. They can't quite trust, or they can't trust at all, what they hear, because they're hearing things that other people can't hear. Auditory hallucinations are the most common form of hallucination a person might have. But it also means they can't always believe what they've come to believe, that they are safe, that the person that shares a bed with them is actually their wife or husband of 30 years, as opposed to a doppelganger who's been replaced because of something, perhaps the big organizations like the CIA, the FBI, the security services, they tend to get evoked, or even the church. It's big, powerful organizations are often evoked in people's delusional beliefs. I'm being followed, or they're listening to me. The television is often, or mobile phones are often, the means by which people feel that they are communicated with by these powerful forces that they can't quite control. And they can come to believe that they have to do the things that they're instructed to do by these voices they believe that they hear and are genuine. It's genuinely the voice of God.
And is that where gang stalking fits in terms of these people feeling that through these delusions that they are being tracked by the state or some other wider body?
Yes. That would generally be the case. I mean, one might want to check that out, because that old adage, just because you're paranoid doesn't mean to say people aren't out to get you. I work a lot with people who are in prison, and you would be daft not to be paranoid in prison, because you need to look out for your own safety. There are various ways that we can test the incredibility of people's delusional beliefs. There are sort of structured means that we can measure them, because we've got a bit of a sliding scale there. Some things are clearly delusional, clearly not correct, that somebody you've never met is in love with you. That is incredible. But what if you had bumped into a person and maybe locked eyes with them, and maybe there was a little bit of a connection, but then you went off and thought there is a connection between us, and maybe inflated that. That could be, rather than a delusional belief, it could be an overvalued idea, something that you've maybe inflated. And maybe when you think about when you've been in your teenage years and you've got a crush on someone, and you also reciprocate that feeling, it gets a little bit of a, you want to believe it.
Yeah.
So that's a little bit.
Pardon my dog's barking there.
Your dog's very well.
And that'll be the postman that comes every single day. But anyway, so I mean, where do we start then? Because we've got a selection of terms that are used every day. I think mindful that what's going on in the world of politics and all that, and we certainly had a fascinating chat about this. Let's start with narcissism.
Yeah.
What is narcissism? If you are narcissistic, what does that actually mean?
That's it. You've got me. You're asking me a question about probably my favourite subject in the whole world. So you better watch the clock, because I could go on at some length. And I, just so you know, from the very start of my training in psychology, my undergraduate degree, I looked at personality, and then my clinical degree, the research I did then, I also looked at personality. My doctorate was also on personality. And then my postdoctoral research fellowships were in personality disorder and the link between personality problems and risk. And my clinical practice since the ending of my second postdoc, which was early noughties, has almost all been with people with personality problems. So this has been my professional background. And narcissism and its pathological forms has been probably front and center, because the question you need to follow up with is, well, what's the difference between pathological narcissism and psychopathy? But we'll come back to that. What's narcissism? Right. Well, narcissism is a form of personality. It's a personality trait, we might say. It's a strand of personality. It's associated with self-regard. So we all need to be a little bit narcissistic, okay? If I had, when we were in the pub, if I had just, apropos of nothing, reached across the table and poked you in the eye, you would have quite rightly said, how dare you? How dare you do that? I'm going to phone them.
Or something similar.
Or something similar. That would have been a wrong thing for me to have done. Or it might be physical harm. It could be, I could have said something really rude or something very critical of you. It was completely unjustified. And you should absolutely have been not accepted that. And that's a normal, healthy level of narcissism, saying, I am worthy of respect. Okay? If you had said, oh gosh, I wonder what I did to deserve that, because I must have deserved it, that would be a bad thing. And I've worked a lot in services, in criminal justice services, prisons, secure hospitals, where I've worked with people who have been like that, where they simply have no capacity to stop people from harming them. They have been victimised often from a very young age and just assume that a victimised state is the natural state for them, because they lack even a basic level of self-respect and self-regard. So they've got no barriers. So they get together with people who hurt them continuously. So it is important and healthy for people to be a little bit narcissistic, but it's on a dimension. And people can be a little bit more narcissistic than most. And some people can be narcissistic to the point that it's a problem. And that's where we would start to think about pathological narcissism or narcissistic personality disorder, where a person's got more than a sneaky suspicion that they're better than other people. And they actually go out there and act in a way that undermines others. They are people who might show off in a way that can be a bit irritating. I mean, we've probably all met people who are a little bit, they've got lots of, they brag a lot in a way that can be a little bit boring. That's kind of, that's okay. That's fairly harmless. But if the way in which they self-aggrandize is at the cost of other people, so they put other people down in order to feel better about themselves. They might say something like, you're a really low level person. See me, I'm a much higher level person. So that's where it starts to become more problematic, where I'm putting you down in order to feel better. And often when there's an audience. So, and in my pathologically narcissistic state, I might think those people are looking at me and thinking, oh my gosh, I wish I could be like that person. The assumption is that by making these sorts of statements, I'm putting myself in a position where I'm admired. I'm not just looking for attention, I'm looking for admiring attention.
Is there a difference then between narcissism and vanity?
No, they certainly overlap. Lots of us can be a little bit vain. I have spent moments in front of the mirror this morning because I'm thinking, I've brushed my teeth because is, I'm going to confront somebody online, and I want to be respectable. So that's vanity. But where you've got a person who cannot pass a reflective surface without looking at themselves in the mirror, then you're starting to, or for me, I might think, well, that's a curious little piece of information. There could be very good reasons for that. It could be quite insecure. So one would never take one piece of information like hogging the mirror and make an assumption that means you're pathologically narcissistic. It just means, oh, that's an interesting piece of information. I might be curious enough to look for other pieces of information that suggest a self-centeredness, as in I am the center of my world, and I've made an assumption that I'm the center of yours as well, even though I've only just met you, or even though we've not even met. So vanity it can be a component part, but we can see vanity in lots of very balanced, healthy individuals. In pathologically narcissistic people, we will see vanity in spades, in absolute spades. So even once we get to pathologically narcissistic, even then we've got grades of severity. So one could have a boss who's mildly personality disorder, narcissistic personality disorder, like a mild form of it, which just means that they are a bit of a nightmare to be around. They're always talking about themselves. They hog the conversation. They put other people down. But, they're good at their jobs. They can work. They don't hurt people. They're just a bit irritating. They can they can claim the credit for things that other people have done. That can lead to complaints in a work setting.
Sounds like a politician to me.
I'm saying nothing. I might have said it in the pub in a private conversation.
No, but I didn't mean a politician. I mean politicians genuinely, that they kind of claim the credit for everything, and it's always about them rather than others.
I wouldn't like to generalise, because I think I've met and follow some politicians that I have huge amounts of respect for.
I agree.
I wouldn't like to generalise.
But we could name those on one hand, couldn't we?
I think that what you've got to be, however, when you think about people who are public facing, they have to have a lot of self-confidence, don't they?
But the interesting thing is how genuine is that
belief in yourself?
Yeah, but how genuine is that in terms of, is it based on fact or is it based on covering an insecurity?
Yeah, that's great, and that's where a superficial look at them on the television, for example, is not going to answer that question. And even like a documentary going into them in more detail wouldn't necessarily answer that question. The best way, unfortunately, for everybody else, apart from me and people like me, is the best way to figure that out is to sit down with them and let them talk. And apply, I say I've done lots of work on personality, so I've got lots of sort of frameworks of personality in my mind, which help me make sense of what people tell me. Because we are like a species of storytellers. And we make sense of ourselves, and we make sense of the world, and we make sense of other people by the stories that we tell of them, that they tell of us, that we tell of each other. So my job of all my wonderful colleagues, is to evoke those stories. And it's through the stories that we can start to see how people are put together, whether they're put together well, or whether, in fact, they're not put together so well at all. They're a bit of to coin a Scottish phrase, they're a bit of a sugary hoose, so they're not very stable. Or whether, in fact, the foundations are secure and you've got a castle built on rock.
So is kind of narcissistic, as in a pathological narcissistic person, can they be dangerous? Yes,
they can be, and that's the severity thing. Even there might be people quite severely narcissistic or extremely narcissistic. They can function somewhat, but they are much more likely to have trouble. So if I believed that I was the only great person in the world, if I walked into a room assuming that everybody else admires me and wants to be like me, and is prepared to give me money to do that. And I'm thinking, oh, I deserve this. I truly am a force for good. And these people should be grateful to be around me. So yes, I'll just charge you whatever it is. And you can sit at my feet, blah, blah. Then you've got extortion, you've got fraud, which is deeply problematic. You've got the potential to influence people who are vulnerable to certain sorts of messages. So you can have an online, or not even online, presence. And you look at cult leaders, for example, and you might see some of these traits in those individuals who put themselves on a higher plane and expect and reinforce and demand, sometimes with menaces, the devotion of others, including the financial, handing over the money. I see pathological narcissism in quite a lot of the people that I have worked with, I have assessed in my job. So, for example, we may see pathological narcissism in people who commit serious sexual offences like rape. So what we might see is a person who thinks they're the big cheese, super big cheese, and they are with another person who does not act as they expect. And they have a sort of frustrated entitlement. So I have taken you out, I have shown you a good time, I have whatever. If I was the pathologically narcissistic person, I might feel entitled to take something from you, which could be intimacy, whether you like it or not, because I'm old, because I don't see you as a three-dimensional person worthy of respect. I see you as an object for my pleasure. That's when we get to the extreme levels of pathological narcissism. We have those highly dysfunctional relationships, attachments towards other people, which permit these really harmful acts to take place. So a person might force themselves on another person, on a victim, and feel perfectly all right about it. They've taken what is, in their minds, their due. So in that sort of situation, a person has been victimized directly as a consequence of the personality problems experienced by the perpetrator.
And what happens then when you challenge or confront those people? In so much as you're saying to them, you're not the big cheese, you're not the person you think you are, and you're challenging their self-perspective.
No, that's a good question. And I would do that. I do that. But I have to be clear about the reasons why I'm seeing that person. If I'm seeing a person for therapy because I want to shift some element of their element of how they express their personalities, maybe less value in saying, see you, you're not a big cheese. What that's going to do is make the person feel injured. We might refer to that as a narcissistic injury, which generates narcissistic rage in a sort of a cyclical way. To humiliate that person is to invite them to then dominate me.
To prove you wrong. To prove you wrong.
To prove me wrong, yeah. Because if I think I'm a big cheese and you come along and say, Caroline, you're nothing. You're just this or that. You're in prison. You're whatever. You're no big cheese at all. I will feel humiliated. As a pathologically narcissistic individual, I will do anything to avoid humiliation, guilt, embarrassment. These emotions which most of us feel sometimes and live with. It's unpleasant. We'll try and make amends. But for a pathologically narcissistic person, what you will tend to do is get an overwhelming projection of rage in order to protect that super vulnerable part of them. They cannot accept that. Right. So you'll see them hit right back in a way that's proportionate in scale and nature to the injury they've perceived. So if I said to a person, you're not a big cheese, and words to that effect, they'll probably come back to me and say, see you, you dirty little woman, you're a trollop, you're and really put me down, much more so than me saying, you're not as big as you think you are. They might absolutely come after me, and they can come after me to my face. They could come after me physically in intimidating or aggressive or even violent gestures, or they could go to the HCPC, for example, and say, see her, she's no good.
Yeah.
She's unprofessional, and make a formal reputational complaint.
So can you, so sort of malicious complaints and malicious allegations, is that kind of
yes,
one of their work?
Definitely. It could be one. I mean, this is why the organisations like the HCPC in the UK are very good at saying, okay, well, let's look at both sides. Let's look at contemporaneous records that were made by both sides, and let's test this out, because it is definitely the case that people in positions of trust abuse hopefully, very small number of people in positions of trust abuse people in their care, clients. So it's for the likes of, it's for an independent body like the HCPC to determine the maliciousness or otherwise. But I could have been unprofessional.
Yeah.
I could have done something that was way over the mark. I could have literally humiliated that person, so that somebody is, eavesdropping in the conversation might have thought, whoa, steady on. Yeah. That's unnecessary. So the person has got a right to complain.
Sure.
But if it was a professionally inspired comment about a person, what if you're not the big cheese you think you are? And I'd like to think I'm reasonably thoughtful about these things. I don't like triggering people's rage. I'd prefer to try and understand where it comes from and come alongside it with alternative ways of protecting themselves from unacceptable feelings, which does take a little time. It's not a quick fix. So I would like to think I don't generally do these sort of humiliating type things, but I think it's entirely the right of the person to say steady on,
to defend themselves.
Yeah, to defend themselves.
So in terms of the spectrum, then, if that's the correct word, of personality disorders, when you hear the term borderline personality disorder, does that mean they're on the cusp, or is it because it infers that? Is that what it means?
Borderline personality disorder is a very controversial personality presentation. In the American system, the American Psychiatric Association system, which I mentioned earlier, called the Diagnostic and Statistical Manual, it's called borderline. In the World Health Organization system, which tends to be used in Europe and the rest of the world, it would be referred to as emotionally unstable personality disorder, with or without impulsivity. So we can use borderline emotionally unstable generally to mean similar things if you're a professional person. Although borderline is maybe something that's got a more common usage, a bit like narcissistic, and which means, just as you were saying earlier on, that these terms can then take on a meaning of their own. They can be used in ways which are more fuzzy than I might use them. I might use them to mean something really quite specific. So borderline is a pattern of personality characteristics, or characteristics that are thought to come from the essence of the individual, which are associated with the presentation of instability. So the behaviour might be unplanned. The mood can change quite quickly. The attitude towards relationships can change quite quickly and rapidly, in the ways in which, for many people who are not, would have not got that label, they may change more slowly. We might change like a big tanker in the sea a little bit slowly, and this is a very severe event. Whereas people who might have this label, professional label, borderline personality disorder, can change pretty quickly. And that's a horrible way to live. If you just felt like the sand under your feet was constantly shifting and changing, not knowing what kind of mood you're going to be in a day-to-day basis, not knowing really how well to manage your mood, and what we can sometimes, by no stretch of the imagination, we can sometimes see people turning to medications, prescribed or indeed not prescribed, and alcohol as ways of trying to manage emotional swings, quite understandably. But often what that then does is just compound the original problem, make it worse and worse, because then you've got drug and alcohol problems, maybe financial problems arising from that. So we can often see, by the time I see some people with this borderline presentation, there's a sort of tangled nest of difficulties a person might have. Most of those difficulties are going to play out in relationships with other people, including with me, as a therapist or a psychologist. So borderline, the term does suggest that a person's on the perhaps on the cusp of being more disordered, but that's more of a historical. The term was developed. The term was used first used to describe this condition associated with instability and impulsivity. Maybe, oh gosh, I'd have to check, but probably about 80 or so years ago. And it meant something different then from what it means now, because we've done a lot more research. But what it does tend to be associated with, and these we can drill down all the personality types to essentially problems in two areas. Problems with a person's sense of self and problems with a person's way of relating to other people. Now, if you think of self, you might think, what the heck does that mean? Well, if I were to ask you a question, how would you describe yourself? And we might have a chat about it. I would synthesize from what you said, your sense of self. I would synthesize its nature. Are you an outgoing person or a bit more shy? Are you a person prone to worrying about things, or are you actually dead laid back? Are you somebody who's got a really fertile imagination and can weep over amazing music, or, in a modern art gallery, or you walk into a gallery and think, Jesus, how much did they pay for that pile of bricks? Are you the kind of person who just generally gets on with other people, or are you a little bit antagonistic? Are you a very disciplined, careful person, meticulous, or are you a little bit slapdash? So I would be able to synthesize the nature of you from what you would tell me in response, and the stories I might then encourage you to tell me. So who first described you as that thing you've just described yourself as? Give me an example of what that was like. So I'll have a chat about it, and I'll synthesize the nature of you. But also what I'll try to do is determine the coherence of that sense of you. I would imagine from just recent chats, Philip, that you've got quite a strong sense of self. You are the same every time I meet you. Not met very often, but you're the same person. You speak in the same way. You relate in the same way. You're not easily offended. You're not easily distracted. You don't dominate. So I've got a sense of you already building slowly over time, and I've got a sense that that's the sense I'm getting of you is built on quite strong foundations. These may have come from your early upbringing, or they may have been acquired by you, or both, indeed, through a strong identification with, for example, being a police officer, being in other areas of professional practice in your life. These identities become very important to us. So what my identity as a psychologist is fundamental to me. If you took away my ability to practice as a psychologist, then it would be, I'm not sure what to do. So when we talk about borderline, and just to come back to self, and the way a person sees themselves impacts how they relate to other people. Right. So if a person's got a strong foundation, a strong sense of themselves, what they say about themselves, it marries up really well with what other people say about them. Then they can go into any situation, know how they're going to react, pretty much, most situations. Obviously, there will be curveballs occasionally, but you know pretty much what to expect of yourself, what other people can expect of you, and that provides security. In that personality presentation called borderline, that sense of self tends to be on sugary ground. It's not securely founded. I might ask a person, how would you describe yourself? And they say, don't know. And even when you probe it, they actually don't know. They don't know the words to say what they're like. And that's for me, it's genuinely, it was difficult to hear somebody say that. Because then if you don't know who you are, if you're not sure who you are, then you're not sure how you're going to react in different situations. You're not sure what you want. So you might try lots of different things and waste time and money.
And is that insecurity? Is that the same thing?
Well, it certainly relates to it. And they've got an incoherent, not well constructed sense of self. There may be walls missing. There may be parts of them that are just not functioning very well, which means that relationships then become an absolute minefield. And distressing, potentially because they might get involved with somebody who likes them rather than they like, the other way around. Most of us, we spend time with people we like, who coincidentally tend to like us too. But for somebody with a borderline presentation, it can be difficult to know whether they like that person because they're not sure how to read the other person. Now, that can have a variety of different origins. It can be about them having been raised in a situation, a caregiving situation from a young age where their parenting, caregiving was inconsistent. They were maybe given contradictory messages. One day you're mummy's wee princess or prince, next day you're a little shit. And so they're like, what the hell? They are told words, or indeed not told words, about their emotions. So you know what it's like when you're little kids, and you from smallest age, your tone of voice, your physical comfort that comes with that tone of voice is consistent, ever present, reliably present. As little people become more verbal, observant and verbal, they can detect the tone of those emotions, attach the emotions to the words that are consistently used to describe them, happy, sad, so that they then acquire the words, and the words have a reliable meaning, so that when they are older and they say, I am happy, when they're older and they say, I'm hungry, when they're older they say, I'm angry, that's precisely what they are. But for people with disrupted early upbringings, or upbringings by people who are maybe not in the best position to coach them in these things, which might happen for a variety of different reasons, they don't acquire that internal dialogue, so that when I come along and say, how would you describe yourself? I don't know.
Because it's inconsistent.
Or they might say blah de blah.
Yeah.
And it doesn't marry up with what they're like.
Yeah.
Because they've just said things that they think I might want to hear.
And so I guess the question then is that all nurture, or is some of that nature? In terms of the subject matter that we've talked about so far, is it nature or is it nurture? It's a kind of a defining question, isn't it? Is it? So, I mean, some people may be, I guess, born with, problematic or misfiring brains, or the synapses haven't connected properly, etc. But the vast majority of us are born with the same kind of functions. Is it then nature that creates these personality challenges in us?
Yeah, that's a huge question, and it is exactly as you say, the defining question, really, of our any of us who refer to ourselves as a psychologist, amateur or otherwise, concentrate on. I'm going to be a really annoying psychologist and say, well, it's a bit of both. Anybody, it's a little thing I usually, when I do training and talks or something, I would say this, and it always tickles me, the response. I would say to an audience of people, those of you with more than one child, how soon did you realise that your second child was completely different from your first child? And usually people laugh. And the responses are often either from the women while I was carrying them.
Oh, wow.
Because of how squirmy they were when they, in the second, third trimester. More often than not, within weeks, if not even days. Depends. And the key ways in which they might be different from their siblings is in terms of that, the things I mentioned earlier about how prone they are to worrying about things. So some children are very laid back, some even from a very early age, and some are much more anxious, need more comfort, more cuddling. a little bit more. They need to be reassured that you're not too far away. How sociable they are. Is this a child who's really happy to go to any sort of party and can just, is really quite spontaneous and just will pile in there to a little kiddies party and just get playing with the other kids? Or are they the kind that will sort of want to go with mum, want mum to stay there for a few minutes, or even go to the party with a friend so they're not there alone? From the very start, they're fine once they get there, but they might have had some anticipatory anxiety. So that's social anxiety. How open they are to new things, trying new things. And then that sort of agreeableness, how well they they get on with other kids, or are they a little bit more of a loner, a little bit more independent, emotionally independent? And then how sort of disciplined are they, or can they be? So often from, in the early months into the early years, we can see those differences. So it's clear, and the research evidence is clear, that we are born with propensities to be certain kinds of people. And the big 5 personality dimensions, neuroticism, extroversion, openness, agreeableness, and conscientiousness, are ones that the field feels that there are biological markers of, that we see behavioural evidence of from a very early age. Okay, so we're all born, we're not blank slates, we're all born with a little bit of this and that, which then nature, as soon as we're born, nature kicks in. Sorry, nurture kicks in, I beg your pardon. Nurture kicks in and shapes it. Now, good enough parenting, we're not talking about excellent parenting. I can't imagine anybody, I'd love to think people could deliver that, but I think most people just do well enough. And that's good enough. Most of the time you're there for your kids, you're there, you're consistent, and that's enough. Kids manage, and they do very well out of that. But sometimes that parenting goes askew, or that caregiving goes askew for whatever reason. There could be a whole host of reasons, and the messaging is inconsistent, and those parental figures are only occasionally there or present emotionally in the room, and that the person's ability to manage themselves then becomes poorer. So let's say somebody's quite a little child's born quite, two little children, separate families, are born quite neurotic, high in that tendency to worry about things. Good enough parenting will help that child over the years to feel that it's okay to be worried about things. They'll model, that parental figure might model being worried about something and then just dealing with it. And then they might show the child how to deal with being worried about things. So going to the party, picking up a friend on the way, so they don't miss out on the party. They get to the party and they have a great time. So they know that anxiety and worry about things can be overcome. And maybe teach them how to, make lists and things so they're nice and organised. Right. So one parental figure might help that dispositionally anxious child to deal with it. And another caregiving situation, where that caregiving is more haphazard, more intermittent, more harder for the child to understand, that tendency towards being anxious might simply never be really trained and disciplined and managed. So that young person may grow up thinking, I can't control this unless I do more drastic things like act up in school, or steal something, or do something that hurts me. And so we can see we've got the same characteristics or traits, but nurture makes the difference in how they're expressed. Right.
Okay, that makes sense.
So part of my job when I'm working in a therapeutic capacity is to look at how people have learned to express themselves and see what we can do to maybe loosen the ties of some of that early learning.
So there seems to be an increased popularity over the last few years with personality tests and psychometric tests and all these other things, and separating us into colours, as an example, is a kind of popular one, and it's one that we did in the police. It started years ago, obviously with Myers-Briggs and all that sort of stuff. What's your kind of perspective from your expertise on the validity of these tests? And I appreciate they're all different, but in general terms, if I just sit down and take a test, how accurate is that likely to be?
Yeah, great question. There are actually several different ways that we can assess people's personality. Self-report questionnaires like Myers-Briggs and lots of the questionnaires that are available out there. These are probably the most common ones. They're generally quite cheap. They're generally quite to administer. It don't take very long, maybe take 20 minutes or so. There's some much longer ones. But they generally don't take very long. An algorithm can give you a readout on yourself. And they can be quite fun to do. And especially if you, like Myers-Briggs works, like how do we put people together like pieces of a jigsaw to create a bigger picture that functions. That works fine. But there are alternatives, and I'll tell you why there are alternatives in a moment, but I'll explain what they are. An alternative I use a lot is what we would refer to as a semi-structured clinical interview. So that's like a scaffolded interview that I'll use with somebody. So they won't be filling out a piece of paper, ticking boxes on a piece of paper. Instead, we'll be having a conversation like this. But I'll have a kind of framework, it's probably in front of me in the form of a book, so that I don't miss out anything that's important. And I'll go through that and try to draw you out with questions and try to draw out your answers with probes to get a sense of both the nature and the severity, if there are problematic characteristics of what these are, and also to differentiate them from other conditions. Because if somebody's, let's say, depressed, I don't want to mistake that for pessimism, for example. So we've got various rules and things, heuristics or guidance that we want to rule out some of these things, like paranoia. I don't want to attribute your paranoia related to your paranoid schizophrenia to paranoia as a personality characteristic. So we've got various things that we need to sort out first before I would then do this interview. And interviews are generally regarded as the gold standard in personality assessment. I'll come back to the reason why momentarily, just to say that the other options are for me to interview other people about you, again, with this sort of structure. And I could do that in a self-report format, or I could do it in an interview. And then there's these, I think they're quite fun, projective tests. So you've heard of the Rorschach ink blots or the thematic apperception test, where a person is given ambiguous stimuli, either like an ink blot or a photograph that's unclear, and you're invited to tell us, the person's invited to tell a story. And I pull out strands of the story as an indicator of what's underneath in your personality. We don't tend to use that so much in the UK. The projective techniques are used quite a lot in Scandinavia and in North America and in other places, but less so here. Mostly what happens here, probably mostly self-report questionnaires, and specialists like myself would do the interviews. The problem with the questionnaires is two things. One, people can lie. And it tends to be in these questionnaires it's pretty obvious what the right answer is, the one that presents you in a good light. So people will tend to, because they don't want to, goodness me, if you're doing an employment interview in an assessment centre for a job, there's no way you're going to say, oh, I'm a horrible little person. And I think horribly of my colleagues.
Yeah.
I'll speak about them behind your back. You're not going to say these sorts of things. There's that, which is a problem, which is why in my practice, I might use the self-report questionnaire, but I will also use an interview.
Yeah.
And I also speak to other people. So I tend to triangulate my assessments so they're really thorough. But the other thing is people might simply not have insight into themselves. Now, I can give you just really quickly, are we okay for time?
Yep.
Okay. Just a really quick little anecdote. I worked with a person in a secure hospital once. He's no longer with us, but he was a fascinating gentleman and who was very happy to talk to me, which I felt very grateful for, because he gave me great insights, both into his nature and also into the nature of people like him. people like him are people with very severe levels of pathological narcissism. He was a person who had committed a sexual offence that was directly related to his pathological narcissism. Very revengeful sexual attacks on women he felt had slighted him. So I went to him, and this was just touching on what you said earlier on about confronting somebody. I'd reached the point where I did have to do a confrontation, because he was applying through a tribunal to go to conditions of lower security in this the forensic care system. And I had to say, look, I'm worried about this application because there's a couple of things that are wrong, or a couple of things that are not in your favour. One is that you haven't engaged in treatment specifically to do with the offences that you committed. And the other is the difficulty you've got acknowledging that other people have a problem with you. I put it better than that, but basically is that there's still a lot of personality problems, and there have been interventions available to you here that you could have used to try to address that, but you're in blanket denial of the behaviour and of the personality problem. And I was very careful the way I told him this, and it was because there's nothing to be gained by annoying him. And he was a big lad. I certainly didn't want him to hit. I didn't think he would, but nonetheless, I was thoughtful. I didn't want to get his back up so he didn't hear what I was going to say. Anyway, he started to cry. Now, that's not something I'm proud of, and it's not something that happens very often. And to be honest, I was a little bit startled. I hadn't expected him. He was a very sort of hyper-masculine man. So crying for him was something that I thought was, my immediate thought was, oh shit, he's going to feel humiliated about this. And he might take that out on me. And I thought, then he's not going to hear me, what I'm saying. And I really want to erode some of this self-belief he's got in his innocence and in his perfection. So we carried on talking. He didn't get aggressive at all. And anyway, kind of talked a little bit more. And when I left the ward, I said to the nurse in charge, look, this is what's happened. Can you keep an eye on him? I didn't think he would hurt himself, but it wasn't inconceivable that he might have gone out and had a shout at somebody else. And anyway, nothing untoward happened. The nurse was a lovely person. Kept a good eye on him, supported him afterwards. They had a cup of tea and they had a chat about it. Anyway, I was on the ward a couple of days later, and the patient said, indicated to me from across the room, I want a word with you. So I went up to him and said, do you want to talk now? He said, yes, come with me. In that quite dominant way of talking, he had asserted himself. He was back on top, in a sense. Fortunately, the same nurse in charge was on and watching, so he indicated he would keep a wee eye on things. And the patient led me into the room and indicated for me to sit down, and then leaned over the table, put his hands on the table and sort of leaned over the table towards me and said, and I am paraphrasing, it was a while ago, but I have not forgotten what he said. He said, this isn't easy for me to say, but I want to apologise for upsetting you the other day. And I said, tell me what you remember about our conversation. And what he recalled was me feeding back, and I had the paper copy of the report in front of me, feeding back my report and crying. He has a distinct memory of me crying, of me feeling pressurised to say things that I didn't want to say about him, and getting upset about that. And he wanted to know that he understood the position I was in, and he forgave me for that. Now, my understanding of that was that he was stuck between a rock and a hard place. He likes me, he hated what I was saying. So he had to reconcile the two, and he reconciled the two by telling himself and acting accordingly that I had been made to say these things by other forces, the other forces being like the authorities. Mm. And that's how he made sense of it in his head. Mm. Now, that's a fairly clear-cut example. We can all do that in tiny little ways where we maybe, shift our recollection of events to make ourselves feel a little better about, maybe something that happened or was said in tiny little ways. But if we're working with people who've got more severe personality problems, we can see these distortions happening all the time. So self-report questionnaires won't pick those up, or will in fact only reflect the distortions. So we can't rely on them. They're not necessarily reliable indicators, which is why I always use another form of assessment in addition to self-report, if I suspect that might be.
And is it also, there's an issue must be around context. So you mentioned the word paranoia earlier on. Excuse me. Somebody might be feeling paranoid at a specific time because there's a specific set of events going on in their life. And therefore that sense of paranoia may not be their baseline. It's just that's how they're feeling right now because of something external.
Absolutely. We would differentiate between state and trait. A self-report questionnaire is much more likely to pick up your state. So if you've had a horrible journey into work and you're in the middle of a difficult, you're moving house and whatever, you've got the kids are having exams and that's your family members are driving you potty. And I sit down and say, fill in this questionnaire that's going to tell me how you feel. I'm going to get at both barrels, quite rightly. But if I caught you in a day, you've just come back from your holiday, somebody else was looking after your inbox, no crises that had come in while you were on holiday, and you're still in your day 4 after your holiday and you're still in that floaty mood, and I give you my questionnaire, I'll get the floatiness.
Yeah.
So self-report questionnaires can really pick up on that state trait, the state that will be impacted by state. A clinical interview will allow me the opportunity to see that, because invariably that clinical interview will be conducted in more than one session.
Right.
I like to spin things out, so I like to see people several times if I possibly can, so that I can get a sense of how they change over time. And especially I quite often interview people on video link, so prisoners on video link, which allows me then to see them about 5, 6, 7 times. And stuff will be going on in their lives in the prison and so forth. And I get to see them with different contexts, different stuff going on. And I get to see what the continuity is. So context does matter. It colours.
So Caroline, so far we've talked, a range of subjects around personality disorders and the personality, how it grows, how it can be managed, how it develops, etc. And that's been, for me, just fascinating. It's got my mind working. And, I think perhaps maybe many other people might be doing the same, but I'm kind of self-reflecting on my own life and my own upbringing, my own, personality weaknesses or vulnerabilities that I've experienced over the years, etc. But we're going to kind of close this particular session now, because I know what we are going to do is then move on for next month's session to what some people might think are the more dangerous aspects in terms of, psychopathy and functional psychopathy. How do CEOs who are psychopaths, or these high functioning psychopaths that we keep hearing about? I've got a book somewhere saying psychopath in suits. How do they function as opposed to the guy that goes out and, commits mass murder or something? So, fantastic talking to you for phase 1. Those of you listening, stand by, because phase 2 will come, in a month's time, and it'll be even, as interesting as, or even more interesting, because we're moving on to a really interesting area that I think those of us that sometimes are working in the areas of risk, we hear these terms, we don't understand them. And, I've got a couple of examples where I can talk about where I know that Caroline will clarify whether that was right or wrong. So thank you for now. And we'll move on to phase 2.
Thank you for listening to the Diffuse podcast with host Philip Brindell, CEO and founder of Diffuse. Please rate, review, and subscribe on your favorite podcasting platforms.